Here we are. Welcome, everybody. It is Friday night, and we are live with Airway Circle and Dr. Kotlow. Welcome, welcome. Thank you so much for being here.
Thank you for inviting me. I'm looking forward to this for quite a few weeks now.
Oh, that's awesome. Well, I'm first going to introduce Dr. Kotlow, and I do want to remind everyone, and we are a few minutes behind, so whenever we ask a question, if people don't answer right away, it's because they haven't heard it yet. So you might see just now people are logging in. So anyways, if you would like us to know who you are, a lot of times we can't see your name. It just says Facebook user. So you can type your name for us. Something else that I'm going to ask is if you're here live listening to us, type the word simply breathe, and we're going to get you a coupon for Simply Breathe strips. I would like to know who is here live so you get that perk. So let's go ahead and start. Dr. Kotlow, since 1974, Dr. Kotlow has been in private practice serving the specialized needs of children. Dr. Kotlow is known throughout the country for his innovative techniques and caring manner, and has lectured for some of the top dental societies and dental companies. Dr. Kotlow has lectured in Australia, Taiwan, Canada, England, France, and throughout the United States concerning pediatric dentistry and lasers. He has written over 35 articles and authored chapters on pediatric dentistry and lasers for 3 laser textbooks. If I were to tell you guys his accomplishments, honors, and the organizations that he's a member of, we would be here for a long time. So we're just gonna go ahead and
until midnight.
And Laael's here with us today. Thank you for being here, girl. Dr. Kotlow, we spoke a few weeks ago and about a topic, and there's so much that we want to share. I do want to ask everybody, if you guys have questions, please type the questions. We are going to open for questions in about 20-30 minutes. So we decided to start with tongue ties. Why do other medical professionals ignore what we do? So the floor is yours.
Well, it's an interesting question because every time I lecture or every time that I happen to listen to an airway lecture, the comment is always the same. Why doesn't the medical community join in with us? And there is no real answer because in my own practice, I see some days 6 to 12 or more babies, or even older kids up to 18 who are significantly tongue-tied, and they show 5, 10, even 15 different signs of obstructive sleep apnea in their airway. And no one out there in the medical community ever looks at the tongue to see maybe that should be part of the differential diagnosis. Now, we fill out the forms, we send them to the doctors. I've got kids who are on NG tubes, and within 48 hours, the parents pull the tube out because the kid is now eating and breathing. Do you ever get a call back from the GI doctor? No, never. So it's got to be a two-way street. I think in dentistry today, we are merging much closer to medicine because the things we do are all related. And I could give you, airways, breastfeeding, postpartum depression, tooth decay. There's about 12 different things here, the endocrine system. I mean, when I see women coming into the office who are depressed because they haven't bonded to their baby, because they've been told how wonderful nursing is going to be and breastfeeding, and they're shocked because they're in pain and agony. And many of these kids, these parents, I can fix in 30 seconds. And it's a team. And sometimes the problem with the team is there's too many members of the team who are undereducated. Okay. I've got kids who come in and they've seen pediatric dentists, general dentists, pediatricians, ENTs, many lactation people. And it all starts with the idea people want to compensate for a problem. So rather than trying to find the source of the problem, what they end up doing is they try to treat the symptoms reflux is another one. Okay, it's air induced. Are you getting feedback from me by any chance?
It's perfect.
Okay, so many kids come in on drugs which are not recommended for reflux in kids, and they don't have reflux. They have air induced reflux. So it's weird in a way that as a dentist, I'm involved with evaluating all of these different medical problems, and not every time, but many times, releasing the restrictive tethered oral tissues takes care of the problem. Now, that means we also include what I call, in my area, those lactation people and body workers and myofunctional therapists who are educated into how to work as a team. And it's not just the medical community. There are too many people out there who think that they're the most important part of the team, and they don't know anything. So you first have to look at the symptoms. Then you need to know how to do an exam. And that's where the breakdown begins. The physician, ENT, and even many other members of the team look at the baby in the mother's lap, and they look down, excuse me, and they don't get their hands in there. They don't see what's going on. And because they don't do that, they miss all of the tethered oral tissues that are restricted. And it's interesting because a while back, I realized everybody's out there lecturing on tethered oral tissues. Now, that makes me think people don't know what they're lecturing about, because every one of us has tethered oral tissues. By definition, a frenum is going to be tethered to prevent motion of a muscle or whatever they're attached to from moving in the wrong direction. So we need to change two terms. One is stop talking about TOTS, tethered oral tissues, and add an R. And that is, we're talking about restrictive tethered oral tissues. And what's restrictive for one person may not be for another person. So we have to not only look at what's going on, we have to look what can go on down the line. Okay, when you come in with what I classify at 1, 2, 3, and 4 ties, class 4 ties all the way to the tip. That's going to affect speech, airway. It's not just for breastfeeding, but it would be, we see kids twice a year. I want to see newborns as soon as they're born, but at least by age 1. But the real key to this is studies are showing that infants' brains are growing at the rate of 1% per day for the first 90 days. Wow. So if we, when I say putz around and don't do anything for 3 or 4 months, we're putting that child at risk for behavior problems, antisocial problems. And if it's not taken care of, I heard one speaker, and I love the quote. The quote was, "We have the ability to intercept and prevent sleep apnea and other problems when we see children. But when we see adults, we need to treat the results: heart disease, breathing problems, mental disease." So it's a complex problem, simply treated in many cases. And I don't want to oversimplify it, but we need to start getting the medical profession to include evaluating the restrictive tethered oral tissues as part of any type of differential diagnosis, no matter what it is. And that means they don't have to know how to treat it. A pair of scissors doesn't do you any good. Okay, and we also need to drop the word posterior tie, because posterior tie sounds like it's insignificant. Okay, we need to call it, first of all, a distal tie, because it's distal to the tip. So we have what people call an anterior tie, but every anterior tie has a distal component. It's like if you do a half a circumcision, that's what I call it. Or when you go to the OBGYN and he says, "Don't worry, you're just a little bit pregnant." When it comes down to what?
I don't understand why so many people are so okay with the circumcision, but whenever you talk about, barely doing a frenectomy on a baby that has amazing benefits, incredible, they're going to help this child for the rest of their life. So, like you said, intercept to prevent all of these sleep issues. Why do you think there's still such a stigma about releasing tongue ties?
Well, I think it starts with two places, Australia and the Academy of Breastfeeding Medicine. Both of the organizations, the Australian Breastfeeding Group and the AB, Academy of Breastfeeding, have come out with guidelines basically saying lip ties don't exist, buccal ties don't exist, and they talk about problems and complications. Now, I've done over 40,000 laser surgeries. I've never seen one infection, okay? It doesn't mean they're all tongue ties. There are other surgical procedures, but I've never seen an infection, bacterial infection in any patient. I've never seen the hematoma. Now, I know in Australia, they have lactation people hanging out in hospitals waiting for somebody to cut the wrong spot. And I've seen people make a wide incision. They made no incision. I've seen people go to ENT and get charged $2,500 for 2 millimeters, and they ignore all the other tethered oral tissues that are restricted. So why do they ignore it? Well, in dental school, number one, the tongue is known for taste and maybe as a toothbrush. That's it. We don't learn about airway. We don't learn about all the other things I've talked about when we're in dental school. And I got none of this. I received none of this training when I was in my residency. And I have a statement from the president of the Academy of Breastfeeding Medicine that basically says that physicians never get an opportunity to even watch women breastfeed, let alone understand it. So when they're not educated, what happens is they join a practice, and it's a bunch of old fogies that have been practicing forever who don't believe it, and they pass this knowledge on to the newbies. And you know, even in Albany here, we have the Albany Medical Center. I've offered to train and teach the medical residents, and ENT says it's not necessary. They can do all that.
If it was necessary, we would not be having the discussion. We would not be having the issues we're having right now, trying to get these providers to understand the importance of this and how to properly do it.
I mean, I have a 2-hour lecture that started with 3 slides just on the airway alone and the other areas. I mean, whoever thought the endocrine system involved the tongue tie? Okay, but you go back to women who can't nurse, and the brain tells you produce milk and then ejaculate the milk, and it's a cycle. But if you're not nursing and you get depressed and your steroids go up, it shuts down your milk supply.
Wow.
But no one is looking for the cause. They want to treat. Give the baby a bottle.
Yeah, exactly.
I mean, I can talk for 7 hours just like this. So, I mean, I'm willing to keep going. But
it gives me such chills just hearing you talk about this. I'm just thinking back to my son who's 6 now. I think I was in the pediatrician's office every other day, engorged. I had mastitis. I had an abscess. I had the postpartum depression. I nursed for 2 years because I just had to at that point. And it was terrible. And now I'm dealing with a 6-year-old with sleep disordered breathing. And, you know, it's so sad that all of this can be so prevented. And yeah, I'm so happy you're here sharing your knowledge. But I do have chills just thinking about it.
You know, it's every day, though. I mean, I saw a 1-year-old the other day. I mean, I see all ages, but this is a 1-year-old who her 4 front teeth are rotted down to the gum. She has decay in her back teeth. Okay, she's walking around with a bottle in her hand, but the mother couldn't nurse because they told her there was nothing wrong. So here's a child, puts a bottle to sleep with her, so she's got bottle decay. She's got sleep apnea. She's tongue-tied and lip-tied, and they have her on medication to calm her down. She saw a pediatric dentist. She saw a physician. They told her, oh, she's just got bad teeth. I mean, everything this kid, now, whether she truly has sleep apnea, I don't know, because she has 4 abscess front teeth.
Wow.
Okay, so I need to remove the teeth. Maybe her sleep apnea is because she's in chronic pain. Mm-hmm. I saw a 14-year-old who is listed he's got a list 2 pages long of all of his symptoms. When he was 12 weeks old, an ENT snipped 2 millimeters, and the mother thought everything was okay. Now he's got behavior problems, sleep apnea, speech problems, everything. And his tongue is tied 3/4. And it's a big heart-shaped tongue tie. So, I mean, this is a difficult case because he's got all sorts of problems. And I've got to get him with a myofunctional therapist for a month before we even cut the tongue. And I've got to get him to the right orthodontist because the orthodontist is trying to move the teeth forward on the lower jaw and the upper jaw backward.
Oh my
So
God.
it's pervasive within the professional. And I'm not going to just pick on the physicians, you know, medical and dental, because they're taught the wrong information.
Mm-hmm.
And I just don't get it. I went over to Copenhagen and I gave a 7-hour course on the tongue ties and everything. They have 535 pediatricians, and each one was sent a request to come. Not one pediatrician showed up over there. Okay, and it's the same over here. You can't get the medical community to listen. You don't hear dentists speaking at very often at the Academy of Breastfeeding Medicine. And when I first applied, they said, "Oh, we don't accept dentists." Now they do, but it's surprising that we all don't have brain concussions, hitting ourselves against the wall and swimming upstream, because it's just common sense. Listen to the symptoms, include the restrictive tether oral tissues as a part of your differential diagnosis, include the pediatric dentist or family dentist who is knowledgeable in being able to evaluate it. And I also think the lactation people should spend time with their organization and get themselves licensed so that they can make an appropriate diagnosis and get respect from the rest of the community, because they'll be a licensed profession. And I think that's part of the problem right there. So we have parts of the breastfeeding team, and you know, we just had a 10-week airway course, which we gave for the Academy of Laser Dentistry. And even the person who was the chiropractor said, within her own organization, 90% of the chiropractors, she said, don't understand what they're doing with the tongues, and they don't include it. So I don't know how we're going to get there, but it's the most commonly asked question. And every lecture I hear, how do we get medicine to join with us? And, you know, I send them reports. I have copies of the surgery before and after, the mother symptoms, the baby symptoms, what we did, how we did it. They'll send them to ENT and put them in the operating room. We can do it in the office in 10 seconds for the upper and the lower, and no NPO other than for like an hour and a half, because I don't want them to vomit if they're gaggers. And the stories we get from the parents, they're on a $90 a day formula, and the mother's on an elimination diet because the child has such bad reflux, and the tongue is right to the tip. You can't grab onto the nipple, the finger, the pacifier, and as soon as you go near the kid, the baby, they choke and gag. I mean, the symptoms are so simple and obvious. I mean, go to my website, anybody who's listening, and download 2 forms. One of the forms is sleep apnea, and the other form is new baby symptoms and mother symptoms. And it's Kids Teeth, KIDDSTEETH.com. And if you really want to get the whole lecture, you can order my book, SOS for Tots. All right. And all I got to do is either go, I wouldn't go to Amazon. I go to my website because you get it faster through my book dealer. And if you really want it faster, call my office because my staff mails them out all the time.
Perfect. You guys have been so helpful. I'm just getting a message. Somebody says that it's going in and out, that there's almost like a delay on the mic. So you guys, please, we're going to keep trying to turn the volume down and see if on our end everything sounds perfect. But if it keeps going on, please just let us know.
Well, let me try something. I'm going to unplug my earplugs. Okay, can you hear me okay?
We can still hear. It's going to take a couple minutes before they do. So we'll try that and we'll see what they say.
Let me see what happens if I just use my computer rather than my earplugs.
Okay. They're letting me know over here. Perfect.
Yeah, looks good.
So how old do you see them in your office for tongue tie releases?
Well, I'm pediatric dentist. And I'm busy as I can be. So we really limit, in most cases, under 18. I've treated some older kids as favors to other dentists. And I don't treat adults, but I have 3 or 4 adults I have treated because sometimes I teach lasers for Laael, and they'll come in on a Saturday and be my guinea pig so I can release their tongue without any local anesthesia. And I have them videotape before and after. It's amazing what they say. But as a rule, I don't do adults. I just don't have the time. And I always say kids are easy to work on. They're not little adults, but adults are big babies. They're more difficult.
Awesome. So you are seeing older children.
Oh, yeah.
And you do use the laser with everyone?
The only thing I use for surgery is the laser. I have nothing else in the office.
Perfect.
No scalpels, no scissors.
And what do you usually do? You mentioned myofunctional therapy. How old do you start recommending that? We're just curious.
Well, that's still up in the air right now because speaking to Mark Muller, they're trying to lower the age for myofunctional therapy. I'm not sure where myofunctional therapy, craniosacral therapy, and chiropractors intersect.
Mm-hmm.
Okay, I've got kids coming in with torticollis. Again, not diagnosed. They come in, we put them in a chair, and they look like a little tree. And they're really tight. They come in very tense and tight. And, how long were you in labor? Oh, it was 24 hours. And the baby was stuck in the birth canal. And finally, I had to have a C-section. So you got to ask the questions. And we just don't. If you've never asked the questions and haven't been taught the questions, it's like watching a mother nurse. People feel, that's outside the scope of dentistry. But I need to watch that. And I've only had 2 women in all the years who didn't want me to watch.
Mm-hmm. I would have let you watch for 24 hours to help me.
I don't want to do that.
I mean, all the issues that we've been through. I mean, Laael just mentioned hers. I had so much pain, and for 12 weeks, ended up going into PPD because I didn't even want to get close to him. Every time the baby got close to me, I would just completely, I can't do this. It hurts so bad. It's literally the worst pain I have ever felt in my whole life. I don't wish that on anybody. Yeah. And just knowing that something so simple, having a skilled provider around me that could have fixed it, would have made the difference in the world.
And I think that's why there's, every myofunctional therapist, I feel like we all have some kind of story that has led us into this. Yeah.
That's why I'm so passionate about this.
It's like when a parent comes in and says to me, do you release every tongue tie who walks in the door? And my answer is, if you had a broken arm and you went to an orthopedic surgeon, you would expect something to be done. Now, every now and then, I get someone who comes in because their friend said he better be looked at. But they have no symptoms. They have no signs. Obviously, we're not going to do anything. But my answer is, you're here because you have these symptoms.
Exactly.
And you want my evaluation as to whether I think your tongue and lip and cheeks or whatever are interfering with it. And I show them when I put my finger in there, the baby bites down. They tell me on a scale of 1 to 10, it's a toe curling 21. But it's,
toe curling, exactly. Renata, are you sweating thinking about all this?
Oh gosh, don't even remind me. I don't want to have any more kids, and that's one of the biggest reasons. I don't want to have to go through that again. I love children. I wanted to have 5. And the birth process, yes, I had C-sections and it was difficult, but the breastfeeding part, even though I love it and I'm so passionate about it, and I'm such a big advocate, just thinking about going through those first 3 months again, I don't know if I can handle it mentally. But Lori, thank you so much. Lori said that she can hear us very well, and she has a question. She said, what are your golden nuggets, Dr. Kotlow, for successful post-care by parents?
Is she talking about infants? I think so, probably, right? Yeah.
If you're talking about infants, okay. Well, first of all, the consent form that I use says they are aware that after surgery, they need to see the lactation consultant and, if needed, a body work. That's part of the consent.
Awesome.
Okay, so I've been doing this for so many years and work with so many other parts of the breastfeeding team. I can give them a lot of information. Now, I know there are a lot of people out there that don't touch them until we do it. But you know what? If I see a baby with a tie to the tip of the tongue, I'm not going to waste time for all the other parts to come together. I think that tongue needs to be released as soon as possible, but still getting the person to the right person, the aftercare. And a lot of times, this is their fourth or fifth baby, and they don't want to spend the money to go someplace. So I'll never refuse a parent because they won't follow up. But if they call me and tell me they're having problems, I said, well, I told you needed to follow up. Exactly. But I would say, 90% of the time or better, there's good follow-up. And most of my referrals that are not second or third or self-referral come from body workers and lactation people. And, everybody has got their own personality. And, I lectured once and said, I put together a really good team, and my team really works well. And the person said, well, they're not your team. I said, sure they are. These are people who I trust and I can work with and understand. They're not somebody in left field who's going to say something that's wrong. The pearls, I spend, when you come to my office, first of all, you have your form filled out. So I already know your child just by your symptoms in most cases. Then I'll do an exam, and that's the key. You need to do an exam, not virtually. You've got to put your hands into the baby's mouth, which means the baby's head is in my lap, and my fingers are in there. So those so-called posterior ties, which don't exist, pop up. Now, if you understand that 40 to 60% of babies have reflux, and 95% of the time it's due to the tetheral tissues, that means we really have almost 40 to 60% of babies have some kind of ankylosing, as far as I'm concerned. And I don't care if people agree or disagree. That's what I think. Okay. So then I do an exam. Now, your baby is in your lap, but the head is in my lap. So you're watching, and you can see everything I'm doing, and you can see all the cards. Then I put together a 15-minute video, which goes over all of the questions parents ask, and how to do it, and what the aftercare is. And then I come back and I answer any questions. And if they decide to do it, and so this is your decision. If you want it done, we can do it today. Then we'll do it. And it takes, I tell a parent the child's going to be with me for 10 minutes, but they're usually with me for 5 minutes. Okay. And my assistant, who's the nurse, brings me back to the mother. Now, the reason I say 10 minutes is because if I say 5 minutes and I got a problem, they're freaking out.
Yeah. Okay. We're counting the seconds.
Right. I mean, why? Well, I only took you 3 minutes. I said, okay, I can bring the baby back down for another 5 minutes. No. So, I have the baby latch on both sides for about 10 minutes. Then I go back and I go over the aftercare, how to get your fingers in there, elevate the tongue. It's either a scooping action or a pushing, or I have a tongue blade. Now, there is a new instrument that I'm working on with someone, which I'm getting the prototypes this coming week. And it looks like a groove director, only it's covered with rubber. And it's soft, and it has an angle on it, which you can change. And it's going to be almost identical to the groove director, but soft on the edges so it won't hurt, and bendable so you can change your angle. It's going to be available soon if it works the way I hope it to work. Okay, then I give the parent printout, 3 pages long, of the symptoms, what we did in the photograph. I give her 2, one for the lactation consultant and one for the body worker. And then I send it to the pediatrician. Then I have a letter, and I have 10 references, 3 of which are mine, about airways, tongue ties, lip ties, GI problems, and I send that. And if it's a first-time doctor, we send them how to do an exam. And then if they're local, I feed them back in a week to make sure they've been doing the stretches. Meantime, within that week, I want them to see for sure their lactation person, and if they can, the body worker.
So you recommend stretches for them?
Yeah. So I want if you don't stretch, you got to cut. It's going to heal back together. Now, if you do what the ENTs do, they cut here, it's never going to reattach because it's only thin mucosa. But as you get back deeper, now the other trouble is people are cutting too deep and too wide. I mean, I've got patients who I can see. They send me photos. You can almost see the lingual nerve.
Wow.
And the whole bottom is cut out. And then they have bleeding problems and they use silver nitrate. And this is the stuff that gets put up onto the internet.
Yes.
Okay. And I've seen, they use a laser and burn my kid. Never ever seen that if you know what you're doing. So all of these things that these people are writing as contraindications, they're not contraindications because they don't exist if you know how to do the surgery. You know, anybody can have an untoward reaction somehow. But I don't use drugs. I don't use chemicals. We use sugar water for analgesia on the babies. I don't use topical because I don't want them to have it. I don't numb them because I want them to nurse immediately. And once they get above 18 months, usually we'll give them a light sedation, and all it is Dramamine 50 milligrams. It's for car sickness. That's enough to take the edge off, and it's as safe as any drug can be. But a needle injection hurts more than the laser. Now, depends what laser you're using. If you're using diodes, they're going to be more uncomfortable and more chance of collateral damage. And my answer to people who are doing them is, if you're going to do frenectomies and tongue ties on a regular basis, you need to get the right instrument to do it, which means you invest in, to me, I think CO2 is the best, but erbium and CO2 are the two, and not the diodes. I used diodes in the beginning. You know, lasers only came into existence in around 1996, and that was the Nd:YAG. And erbium only became available in 2000, really, in 1998, but really in 2000. And then diodes became available after that. And then CO2 is really only the last 10 or 12 years that it's been available in dentistry. So you're choosing the right laser with the right setting, you don't get collateral damage. It heals quickly. And one of the things I tell parents is in about 4 to 6 hours after surgery, you may have a baby who cries for a minute or 5 minutes or a couple hours. And my premise is only because I always saw it, 4 hours after a laser surgery, the analgesic effect of the laser seems to wear off and the baby starts to cry. And you can, if they're older than like 18 months or 2, you can use Tylenol, but I try to avoid it. There are some homeopathic stuff, arnica, which parents can try. And there's a few other ones that they buy in the health food stores. But I give them a solution of 1 drop of clove oil in 10 cc's of coconut oil, have them shake it up real good, put it in their hand, just rub it into the cut, and we make our own solution. And
there's a question on here for older kids, ages 1 to 4, the 1 to 4 age range. Do you recommend a speech language pathologist, feeding specialist, or therapist instead of the lactation counselor or specialist? So I guess the question is speech therapist, feeding therapist for ages 1 to 4.
It really depends on what the problem is. I'm not so sure I need a speech person involved with a child under the age of 2, although there are some. I know I always, my granddaughter didn't really speak until she was 23 months. Now she's 9 and I'm ready to tack the tongue back down to the.
I think that the main question was if they're not breastfeeding anymore. So we're still going to send to a body worker, and do you send to anybody else?
Well, if they're getting to me now, it's usually because of sleep apnea. And depending on which age, I would say the body worker or the myofunctional therapist is going to come into play more often after age 2. But you know, when I have a child coming in, I don't just put them in a chair and look at them. I watch their gait. I watch how they react. I mean, I had a baby yesterday who was 2 and can't speak, but he's gibberish. And I said to the parent, have your child ever been evaluated for autism? No, no one's ever mentioned it. And I'm not afraid to tell a parent. And I've got letters from parents. They insisted they be evaluated, and they found that they were on the spectrum. So, my job is not to make the diagnosis, but if I see something that I don't think is right, I'm going to refer them to a physician who specializes in behaviors. My staff is pretty good. 3 of my hygienists have been with me between 30 and 40 years. My assistant's 43 years. So they know really what to look for when they're doing their cleaning and stuff. So my office staff knows what to say to me when I go and sit down and look at it and to evaluate. So the older child, it really depends on how articulate they are, what I see as the problem. Most of the time in a 1 and 2 year old, it's going to be behavior from sleep apnea. So it really depends. Most of my referrals are going to be to functional therapists, chiropractors, body workers. Obviously, if they're not nursing, a lot of lactation people won't see a baby who's not nursing.
Mm-hmm.
So
we talked about it with Autumn that it's also important if a baby or if a mom is pumping, exclusively pumping, or just even doing formula, and the baby's still having issues with the bottle and still clicking, they can still see a lactation consultant because they are baby feeding specialists. So they don't do only breast. It's important for moms to know that. You can go to lactation consultant if your baby's having issues feeding. It's okay if you're not nursing. They can help, especially, if they have issues feeding from a bottle, they're still going to need a tongue tie release if the tongue tie is the issue. So it's important for you to follow up with a professional who specializes in that to make sure that they can help you with the process. And me specifically, my functional therapist, I don't see anybody until usually age 5 and up. Like we were speaking in another conversation, usually my functional therapy, they have to copy what you're doing. And children younger than 5, a lot of times cannot. Once in a while, you get a 3 and a 4-year-old that, mature, have older siblings. Yes, even with my 1-year-old, he copies what I do, but I can't really call it my functional therapy. He'll click his tongue. He will do certain things when I do it. But I feel like sometimes, we just get lucky. I couldn't charge somebody for therapy, just hoping that it's going.
Well, for the older kids, the 2-year-old to maybe 5-year-old, what I have them do is if they'll mimic the parent, stick their tongue out and lift it right up and down, I find either peanut butter or non-peanut butter in the palate.
Yes.
Lick it. Tell them to get a shot glass, put something in it, and have them lick it, or even a beater blade with some frosting on it. So there's a couple of ways, and these are ideas parents have given me over the years.
Yeah, and these are things that we can help your children. These are certain things that you can do with your child to try to get them aware of your tongue.
You're coming in and out. Your voice is coming in and out. I can't hear you.
Hear me at all?
Now I can. When you back up, I can.
Internet. I think it's just my internet. But it's probably going to get better now because I turned my phone off. But anyways, it's and I know that some speech pathologists can help children on that age gap from the time that they are no longer drinking formula or breastfeeding up to 4 or 5 when they can see a myofunctional therapist. A lot of these children who are tongue-tied will have some oral motor issues or they will have feeding issues. Most of the kids, they're really tethered. They cannot lateralize the tongue. They have difficulty swallowing. They will avoid certain textures. So at that point, I usually recommend them seeing a speech pathologist or an occupational therapist who is specialized in feeding. If, that little gap that we don't have an IBCLC and they can see a myofunctional therapist.
Well, keep in mind, we're talking about why pediatricians don't understand what we do. But the same thing, unfortunately, was with a lot of speech. I get kids who come in and they've had 3 or 4 years of speech. And and they're tied. Okay, so again, I need my team, who I trust, to work on it, because there's too many people who should be part of the team that aren't educated into how to do an exam, and they try to compensate for a problem which is a physical anomaly, which is easily corrected, and then they can work with retraining the tongue. So it's a frustrating thing. I can talk to the two of you all day long because you know what we're talking about. But when you see a patient coming into your practices who is tongue-tied and they've had all sorts of treatment for a year or two, then you become as frustrated as the parent.
Or 7 years, and then they just graduate.
Exactly, they graduate. Because
and the parents are like, but nothing's changed. But she graduated.
Yeah, I know.
I see the new study that just came out about the, I think 80%, they found out that about 80% of children who have speech issues have tongue-tied.
If you watch the news, CNN had a big article about 3 years ago. A 5-year-old went to a pediatric dentist, and she discovered he had a tongue tie, and he couldn't speak. And when she released it, he started speaking.
Yes, I've seen that.
Okay,
oh my goodness.
My impression is that's malpractice. For 5 years, they didn't discover it. It was there. They misdiagnosed it, or they ignored it. And so when we get into these terms and people look at it, things don't develop when you're tongue-tied. It doesn't all of a sudden show up. That baby should be examined by a competent IBCLC who doesn't have their hands tied behind their back by the medical community.
Thank you.
They don't have a gag on their mouth. So that baby, I have a flow sheet, okay? And the flow sheet says when that baby is born, it goes right on the mother's chest. But within a few hours after they meet each other, someone just has to look. And depending upon what they see, they give the parent my sheet. These are symptoms. If they start to appear, you need help. Now, I had one mother, it was her third kid, okay? And it was right to the tip of the tongue. It was a home birth, and they were 2 blocks away. The baby was in my office at 1 hour old. Okay?
Wow.
It was a class 4 tie to the tip. The mother wanted it done. I saw the baby and held it before she did. Up to that time, it was my granddaughter, which was 24 hours. But no one's going to be an hour unless they deliver in the office. But it all comes down to education, and education, not ignoring and ignoring.
Definitely. And there are so many professionals out there that say, oh my goodness, don't release the tie first. You have to see body work. You have to see this. You have to see that. My gosh. As soon as my baby was born, I knew I couldn't make it. I knew I was not going to be able to nurse him. I mean, he cut me the first time that he latched. As soon as he was born on both sides, I knew it was not going to happen.
And as a new mom, I mean, you have a brand new baby. You're not going to spend 2 days waiting to see a body worker.
Some body work.
If you ever told me that I would be treating postpartum depression and bonding, I'd look at you and say, where does this come from? Okay, so wear many hats. And what I say to parents and what I say when I lecture, there's really nothing in dentistry that you're going to do that will be giving you as much happiness as the parents. And we need to change the idea that breastfeeding is a dyad. It's a triad. Because the baby, the mother, and especially today, you got to look at what's going on with the father. Because if the baby's crying and the mother's crying, the father's going to suffer. And then I throw into other things. What about shaking baby syndrome? What about young parents who aren't educated enough and don't know how to take care of the baby? That baby is refluxing, arching his back, 24-hour pain, and the parent says, you got to stop. They're not murderers, but they just don't know. So when I asked the pathologist, was the baby tongue-tied? They said, what's tongue-tied?
Yeah.
Okay, and then you've got all these nuts out there with guns. How many of these, they're always antisocial. How many of them didn't bond to their parents? And it went all the way through. It was lasting until adulthood.
I have said this for so many years that we as a country, we really need to start focusing a little bit more on mother-baby, that connection. I mean, the United States is one of the only countries in the world that allows 6 weeks, maybe 12 weeks, and most of the time it's not even paid for you to be a baby. Shouldn't we be looking at how important it is for this bonding and this nurture and this, how important it is for children? These are the kids that are going to be ruling the United States, you know, and out there years from now. We are raising these kids, and it's like that old saying, you know, let's raise, what is it? Let's leave. Oh, people say, let's leave a better world to our kids. No, let's leave better children to this world. It needs to start when they're born, and the amount of comfort and love that we give them. And I'm not saying anybody doesn't give love if you let them cry it out, but it's something that that came about because of World War II. When World War II happened, men were not here anymore. Women had to go back to work. They didn't have a choice. So they no longer could nurse their babies until 3 years old like they used to. And all of a sudden, behaviorists came out with all of these articles and all of these books writing that it's okay for you to let your baby cry. It is okay if you can't do these things that you're used to doing. Because, of course, I mean, they couldn't do it, and somebody had to find a way to make sure they didn't feel guilty because of all of this. So then this whole movement started of let's get this child, you know, the individualized and how do you say it? And let's get this child to be independent as fast as we can. You know, the whole mentality of getting the kids out of the house as soon as we can, getting the kids out of the room as soon as we can, getting the kids off the boob as soon as we can, you know, and the focus going more on the parents. I just feel like this has gone way downhill, and several of the issues of mental health that we are seeing nowadays in the United States goes back to a mother who did not, for some reason, or one reason or another, could not bond with that baby properly. And, you know, and so many parents also complain, or so many moms complain that the dad is not in with the breastfeeding, or they don't have any support. You know, they don't want me to breastfeed outside of the house. They don't want me to breastfeed in front of anybody. This whole stigma around breastfeeding, it really needs to change. And we really, as a community, need to get back together and start giving these moms more time to stay home with their babies. It is so important, not just for one thing, but for our whole community and what's going to happen to our world, you know, after these kids are out there. They need this time with their moms. You can't spoil a child with love.
Well, the other problem is the insurance companies and the physicians. If you go back when my kids were born in the early 70s, okay, everybody got their tonsils and adenoids out, okay, which means the airways were okay. Now, I know when I was in high school, we didn't know about Asperger's. We didn't know about ADD or ADHD. We had kids in our classes who were considered mentally retarded or different. We don't use those terms anymore. But what happened was the group of physicians and the insurance companies decided too many tonsils and adenoids were being taken out. And then all of a sudden, they stopped taking them out and used antibiotics. Well, that whole group of kids had airway problems that no one treated. And that's all of a sudden, we started getting ADD and ADHD. Now, the pendulum has swung the other way around. Now we're removing 80% of the tonsils and adenoids for airway problems. So there's that whole area in there of children who grew up where no one examined their airway, and they probably didn't nurse, but they didn't have an open airway, and that's where their behavior problems occurred. And everybody put them on drugs. Hopefully the pendulum is swinging because parents don't want their kids on drugs. But it all goes back again to examining the oral cavity to find out if there's restrictive tetral tissues. And when the older kids come in looking at their tonsils, there's a lot of kids who come in with enlarged tonsils, And I send the parent, you have to get the tonsils out before I can work on your child. He's not a gagger. Okay. He gags because anything put in his mouth closes his airway.
Mm-hmm.
But this whole thing that you just talked about in bonding, Michelle Emanuel did a whole hour and a half on it in our discussion group, and it's getting to the point where my 6.5 hour lecture on our talk is almost going to have to be 2 days, because each one of these topics can't be discussed in 3 slides, and you need to educate. It's not just breastfeeding, but all the things we're talking about. And bonding is a huge issue to me. I mean, the first thing I say to a mother when she comes in, the first thing after I look at the kid, I want you to understand none of this is your fault. So get rid of all your guilt. You've been told you're a new mother. You're told you're overactive. Forget it. This baby has an anatomic restriction, which is preventing them from bonding, and you expected it to bond. And they start to cry because I've taken a big rock off of their shoulder. Big weight. So,
I mean, I can feel it.
I know I went on a little rant right there, and this is not to blame anybody who has done things a certain way. What I'm blaming here is the pressure from society that has put mothers in that position that you feel like you have to do things like others are telling you to do, because your friend or your mother-in-law or whoever is telling you, no, this child has been, nursing too long, or this child cannot sleep with you, or cannot do this, or cannot do that. You know what I mean? Just
or they have teeth now. So you're going to stop.
Well, I like it when the grandmother says, breastfeeding is not supposed to be pleasurable. It's supposed to hurt.
Oh, grandma.
Grandma's like, keep melody. The best thing about the COVID crisis is I only allow mothers and fathers with the babies, okay? And I don't allow mothers in the office with the kids when they're getting their teeth cleaned. We keep everybody separate, and we have 2 separate entrances now. We only have the babies come in one area and all the other kids in another, so we keep them separated, because the babies, the older kids are going to become the carriers, and we don't want the babies or the parents to get infected. Fortunately, the vaccines is becoming better, but when a grandmother comes in with a mother because the father couldn't make it, I want to just close it down. They're the ones who have more questions. Well, we didn't do that, and we didn't do that. I said, that doesn't mean it was right.
You got to have some lift tape ready to go. Here, nasal breathing.
That's what duct tape is for. All perfect.
Oh my goodness, guys, this has been an amazing talk.
So awesome.
I do want to know if anybody has any last questions. Please post your questions. We have Dr. Kotlow with us today, who is taking time out of his busy Friday to answer anything we may have. Somebody just mentioned that they're going to share this with their office. So what is that you'd like your office to know, coming straight from one of the pioneers in the field? People are very excited over here. And Ruth did mention, Ruth is a occupational therapist. She said that the bonding reflex was one of the things just discussed at the Feeding Matters conference. That is so good. So there is a bonding reflex. So do you think the increase of hyperactivity we see has some base in children not getting outside to move their bodies as much as they did back in the day, since they're inside on electronics now? Less sensory input leading to decreased sleep, or I don't know what you think. What do you think?
Oh man, that's a loaded question. I can't answer that question. I mean, you can talk to psychiatrists and psychologists, and they're going to tell you, going to bed, watching TV and watching your computer, the blue lights and the red lights and the yellow lights stimulate you and prevent you from going to sleep. They say everybody, including adults, should shut everything off an hour before they want to go to sleep. Not get into bed and watch TV and then shut it off and think they're going to do it. So, I'm not going to touch that. You need a psychologist on there before,
You're right here talking about tongue tie.
What I'm here to say is we need to all work as a team, understand each person's position, but each person within that position has the responsibility to be educated and knowledgeable and understand where they fit and when they should be part of it and how soon. So we need not to look at, you have to do this first. It's look at the structure. If it's to the tip, you can't stretch it, and you've got 90 days to get this straightened out. Okay, I can fix that part of it in less than 2 minutes. Then your job is to work with the mother on making sure she follows up. So, of course, the IBCLC is important. Of course, the body worker, the myofunctional therapy, the speech, but in the right time.
Definitely.
And that means they don't spend years doing something to compensate. You don't compensate for ankylosing. You fix it, and then you work with the structure the way it's supposed to be. Get rid of the word compensate. Get rid of posterior ties, and get rid of it's my job first. Look at the structure. Look at what the problem is. If it's a class 1 and 2 tongue tie, go for it. Spend a week or two with a lactation person. But as you said, I know it hurts. I don't want to give it up. I don't want to be in pain. Work together as a team. So the other members refer out and say, listen, we've tried for a few days. It's not working. We think he's tongue tied. We think you should take a look at it. And if you think it needs to be corrected, go for it. But we need to work together in the right time. And that's the most important thing today. We can do it as long as we work as a team and the team members are educated.
And I have a question about that then.
Say that again?
A myofunctional therapist, there are several of us here who live in smaller communities that we do not have an ENT or a dentist or somebody that is very skilled to do these procedures. How do we, as either dental hygienists or speech pathologists who are nobodies whenever it comes to certain doctors, that's how we feel. We're not nobodies. We do a lot, but we are made feel this way by so many medical professionals. Do you have some advice of how we should approach?
You know what? I've got pediatricians all around me who tell parents all I do is cut to make money and to pay for my laser. Okay, I can retire tomorrow. I've been in practice 47 years. I'm not doing this to make money, okay?
He's still trying to pay for his laser.
They're closed-minded. The only thing you can do is say, I'm sending you this report. Please put it in the patient's chart.
Perfect.
So it can be documented at a later date if you ignore it. Okay? Because they have to put everything you say in paper on there and into the chart. And, maybe, that's why I send the physicians everything. Sometimes I hear they're thrown in the basket. Okay? But I documented in my chart what it was sent to the pediatrician. Somebody's going to come back and they're going to make a big issue of it. And at that time, it'll become more mainstream. But there's a study that says it takes 17 years for studies to become facts. And I've been doing it for over 20 and still not fact. Okay, so closed-minded, I don't know what to tell you. You need to be more forceful and say, look, I don't want to sit and have this patient continue to suffer. We need someone who is going to do this without a pair of scissors and do it completely. And our opinion is our suggestion is you can't make the diagnosis, but it's like a nurse saying, you have all the symptoms of diabetes. Maybe you should be checked out. Exactly. You have all the symptoms of ankylosing and restricted tetheral tissues. It needs to be checked out and evaluated properly. And anybody who looks at your baby and doesn't put their head in the lap, get up and leave.
Exactly. And I am so glad that you did say something about IBCLCs and they should be seeing the baby first if there's an issue, because so many pediatricians, and I worked at a hospital over here for 4 months or so with the lactation consultants. I did a little internship with them. And I remember, as soon as I came in, I was like, okay, tongue ties, tell me, what do you know? They were like, oh my goodness, you cannot say that to the mom when you go in. Even if you think there's one, if the pediatrician walks in and the mom said, the lactation consultant thinks there may be a tongue tie, ooh, that is bad. Like you can't, because you can't diagnose. But my goodness, how much of this information do they have in medical school? We really need to be a little bit more gracious and a little bit more open and a little bit more respectful for other people's education and expertise. Because if we all work together, and that is why we're here on Airway Circle, we're trying to bring all of these specialties together and to share all this information with you guys, so you guys can share conversations like this one. So this Facebook Live, please share this on your personal page. You know, maybe you're gonna reach a mom that needed to see this, that really needed to hear this, or a professional.
I'm always ready to give a lecture, and they're all set. So, you know.
And if somebody would like, do you teach professionals how to use the laser, or how to?
Well, with COVID, I don't have people in the office anymore, but I do have a lecture on soft tissue surgery, which covers all of the soft tissue surgery using the laser.
What about any trainings for pediatricians that maybe are open to? Because there are some in my area that are looking into this more. At least they're talking about it. We actually have a pediatric dentist going into a pediatrician's practice, and they're going to listen. So I'm so excited for that. But what is there? Do you have like a training or something for these pediatricians, or something that could help them understand more the why?
Well, the first thing I do is buy my book. Okay.
Yeah.
Now, what we do is, and I have lots of dentists who buy the books, I give every patient a copy of my book to read and pass on. Yeah, Gemma, you're 100% right, my dear. I also send every pediatrician who's new a copy of my book. And as I've said, I've got a 2-hour course which covers all of the possibilities, symptoms, diagnosis, and how we do it. It's 2 hours. So, I mean, I can take any evening and give a course any place in the country through Zoom if people are interested. And I don't charge a whole lot to do it.
That's where we all come in. There's 26 people watching this live right now. I want every single one of you to hit share and share this on your personal page. Let's try to make this video that we just had today viral and try to get moms, because if we empower moms with this information, they're going to go to professionals and they're going to start asking questions, and they're going to want to try to help their kids. So we are here to share this information with you guys, but it's in everybody's responsibility to try to get this message out there with us. So thank you, thank you, thank you.
Well, it's my pleasure. Anytime. I'll come on anytime you want. I don't need a lot of notice.
I really appreciate you being here. I really appreciate your time and all your knowledge.
Thank you.
It's been wonderful. We do have a new giveaway that is going to be announced tomorrow morning. You guys do not want to miss this at 6 a.m. tomorrow morning on our Facebook group, Airway Circle, our new giveaway. So stay tuned so you can enter that. I will share some information on how Dr. Kotlow, how you can get to watch his course and how to get his book. So also on our page, all the information is going to be there. And last thing, Dr. Kotlow, if parents want to get in touch with you to schedule a consult, you gave us your email, or not email, but the website, right? They can just go on the website.
Right.
And
just have them call the office at 518-489-2571. 518, area code 518-489-2571. If someone wants to email me a question, I can't make a diagnosis, but if they have a question, my email is kidsteeth@aol.com with 2 Ds.
Perfect. You're just supposed to get the phone number for the office over there.
Yes.
Thanks, everybody, for being here. This has been a wonderful talk. Next week, we have some amazing clubhouses already specific for you guys. We have Tuesday all about fascia. We have some amazing people who are going to come. Fascia Quest. The whole Fascia Quest is coming to talk to us. On Thursday, we're going to have a talk about ALF. And on Friday is going to be another incredible speaker, and it's going to be all about breathing. You guys are welcome to guess that one, who it is. And we will see you on Tuesday on Clubhouse at 8 p.m. Eastern Standard Time. Thank you so much. And I want to see at least 26 shares of this video. Let's do it.
All right, well, thank you for inviting me. And like I said, anytime.
Thank you.
All right.
Appreciate it. Bye-bye.
Bye-bye.